Dear students, I am inviting you all to our Sri Chaitanya's a new approach for consolidation. In fact, it is a unique method for the consolidation of the topics here. Definitely, because of this reason, the knowledge levels in the mind of the child will elevate like anything, so that they will get comfort as well as confidence to write the exam. Actually, that innovative program, this unique program's name is Chapter at a Glance. Chapter at a Glance, here I am discussing reproductive health. Already you know the topic reproductive health. Actually, as a student, you have started your reading of these plus 1 and plus 2 textbooks, junior enter one time, senior enter one time, and revision time. So, you have gone through the topics, you revised it, you consolidate it. Still, our opinion is no student is having 100% knowledge in that area. I am not insulting your knowledge, and you know most of the things of the topic, but not all. The reason is 1 or 2 or 3 areas, just they count around just 1 or 2% only. That may not be covered by the student, or neglected by the student, or not looked by the student, those things will happen. While the repeated revisions and consolidation is going on, the student will go through that topic, what is known to you, that points are known to you. Uncovered areas are left uncovered. So that's why this is a most useful approach for the perfect consolidation of the topic. Every nook and corner of the topic and every point pinpointedly will show, will highlight. Automatically you will get the confidence where you are having the strength, where slight uncovered areas are there, then which are focused now. That is for our benefit to reach the every answer of every question. That's it all. That's the actual idea of the chapter at a glance. Now, the topic what I am explaining, that is reproductive health. And in order to start this topic, already you know it well, the earlier topic, human reproduction, the commanding knowledge in the topic is essential. In that human reproduction, male reproductive system, associated glands, female reproductive system, associated glands, then spermatogenesis, oogenesis, fertilization, implantation, and menstrual cycle, and various developmental stages, month-wise, during pregnancy, you've gone through that. After getting 100% knowledge in that, you have to come to this reproductive health. Why? Because the basement for this, that topic only. So, first you read the topic, then come here. Now, reproductive health, actually, see this area. Average number of questions in NEET per year. First of all, you have to have a clear idea of the topic here. How many questions are appearing in our paper? It is 1 to 2 per year. But the fact is minimum 2. But when it is minimum 2, why don't you write the average number 2? Why? Because last year, 2025, only just 1 question was designed. That is a multiple statement question. Because the length of the question, the paper setter decided 1 question is enough. That may be the reason. But when I have seen 10 question papers, minimum 8 question papers, 2 questions. But last year 1. But when you go to the 2023, 3 questions were asked. 3 is rare, 1 is rare, most common is 2. I will show that questions also, you see that. So this is the data, PYQ, previous year's questions, 2023, 24 and 25. 2023, in this chapter 3 questions were appeared, 1 assertion reason question, 1 matching type, 1 normal multiple choice question. 2024, as I said, 2 questions, 1 is matching type, other one is a multiple choice question. And 2025, just only 1 question, that is multiple statements. So because of the length of the question, I think second question is not selected, but this is a regular practice in all papers. Of course, I will show all the questions here, then you can understand what the style of questionnaire, based on that you can prepare. prepare. So that's why let us start the showing that questions also. Now coming to the 2025 latest paper, and what are the potential drawbacks in the adaptation of the IVF method. Here some statements are given, A, B, C, D, E, F. See the first statement, high fatality risk to the mother. Second one, expensive instruments and reagents. Third, that is C, husband and wife necessary for being donors. D, less adaptation of orphans. E, not available in India. So you cannot find these sentences in NCERT, but it's a general knowledge, general awareness. Why? Because see the first one here, high fatality risk to the mother. Mothers will not die. When you are going for IVF clinic, it's not at the cost of the mother. So it's a simple logical area. So absolutely it is wrong automatically. And A is present in first option, second option, and fourth option. So naturally, 3 is the answer. So in this way, you have to handle. It is called a thought-provoking questions. That means some content is taken from NCERT, some basic general knowledge is added to that, and it will provoke your thought process in examination hall. That's why my opinion 2025, as it is a multiple statement question, reason number 1, thought-provoking question, reason number 2, that's why only one question was asked. That's about 2025. Now let us come back to the 2024. As I said, 2 questions were asked here. One is 2-column matching, you see here, non-medicated IUD, copper-releasing IUD, hormone-releasing IUD, implants, and you have to match. You have to match. Here, 4 items are taken, and you have to match all the 4. It's a multiple testing. Multiple testing is not 1 point. 1 point here, as we have seen earlier, like this. So coming to the next one, it's simple MCQ. Which of the following is not a natural or traditional contraceptive method? Direct question this is. Natural contraceptive methods, 3 methods are there. That is periodic abstinence, withdrawal, lactation, amenorrhea. In 3 options, these are mentioned here. So naturally, warts. Warts are the barrier method. So this is the answer. So 2 questions in 2024. One is 2-column matching. Other one is normal multiple choice question. It's a fair straight question. Any student can reach it. Multiple choice 2-column matching. 4 points you have to match. Coming to the 2023, 3 questions were asked here. And here one is assertionism question. Amniocentesis for sex determination is one of the strategies of reproductive and child health care program. It is wrong. Reproductive and child health care program is to provide comfort to the mother and child, not knowing the sex determination. So assertion is wrong. Coming to the reason, ban on amniocentesis checks increasing menace of female feticide. Female babies are killed brutally. That's why Government of India banned amniocentesis. Reason is correct. So this is assertionism question. Second one, 2-column matching. Generally, 2-column matchings are more. Out of 2 questions, one should be 2-column matching, other either assertion reason or statement 1-2 type or multiple statement type or MCQ. They will go for that condition here. So you have to go for this vasectomy, coitus interruptus, cervical caps. So here you have to match with oral method, barrier method, surgical method, natural method, straight. Only 4 points should be matched here. Now coming to the third question. Which one of the following common sexually transmitted disease is? That is here genital herpes, gonorrhea, hepatitis B and HIV infection. So the answer is gonorrhea. So after seeing these questions, you can understand what is needed. Sometimes assertionism questions, sometimes multiple statements, sometimes innovative questions. Most of this is matching, rare time. Simple questions. One MCQ is compulsory. Other one, it may be assertion reason or multiple statements or 1 or 2. So go in that line. Okay. This is about the the examination pattern of this chapter. Yes, now I am showing you our NCERT book. It is a plus 2 textbook here, chapter number 3, reproductive health. This is the first page. Here, what are the points which are very important, crucial? I have highlighted here. According to the World Health Organization, reproductive health means, it's a definition of reproductive health, a total well-being in all aspects of reproduction. That is physical, emotional, behavioral and social. 4. Physical well-being, emotional well-being, social well-being and behavioral well-being all together. Sometimes it may be asked. Why? Because they are asking statement-wise questions. In that condition, it is important here. So, according to World Health Organization, the complete physical, emotional, behavioral and social well-being that comes under reproductive health, that is only highlighted. Now, coming to the reproductive health problems and strategies. Here, Government of India started family planning programs. The year is very important, 1951. In this topic, the years are important. Family planning programs were launched by Government of India. In which year? Fair question, simple question. And you have to say that 1951. Like that, Government of India, government legalized MTP. That is another question. And MTP, Amendment Act 2017. Like that they can ask here, see this area. So after that, coming to the second page of the chapter, here, reproductive and child health care programs. Already you have seen the question related to this. Reproductive and child health care programs. It is to aim to give health to the mother as well as the babies here. And these are launched under family planning programs by Government of India. Then later, how to achieve the reproductive health. That is very important. Here you have to take the support of audio-visual means print media. This is electronic media. This print media means newspapers and non-government agencies, and they have to make this information more popular among the people. Then only we can achieve reproductive health. Second one, introduction of sex education in schools. Up to school level, common curriculum is there. That means if you have introduced the sex education, the people, the students will get awareness of male and female reproductive systems here. So that should be another point here. Then proper information about all this. That is about reproductive organs, adolescence and related changes, safe and hygienic sexual practices, sexually transmitted diseases, AIDS, and would help people, especially those in adolescent age group. Well, because adolescence, you know it well, and during that time, the child will attract towards some of the things, the so-called deviations. So that's why the reproductive health, to achieve this, the proper information should be given. Then educating the people, especially fertile couples and those in a marriageable age group. That's very, very important here. Marriageable age, official marriageable age group, that is 18 years for females, 21 years for males, as you know it well, and that we have to explain. Then another one, the importance of breastfeeding, equal opportunities for the male and female, etc. Here, it's a general topic. Then how to achieve reproductive health. Very simple, by introducing sex education in schools here, by using print media, electronic media, by providing awareness about prenatal, postnatal, the care, then the abortions, what is menstrual cycle, and what are the STDs. When you have popularized this information, automatically the people will have the proper physical well-being, mental well-being, etc. here. So this is the area here. Now come to the next one. Here, amniocentesis. Just now you have seen one assertion is in question here. This is amniocentesis for sex education, sex determination. And it is a diagnostic technique here. And because of this invention of this, it is being wrongly used by the people here. How? Because after knowing that the growing fetus is a female, most of the couples, most of the males and females, unfortunately, they don't want to have the female child. It's absolutely wrong. Why? Because both male and female both are equal. They must be generally in equal ratio, but people are not thinking in that line. That's why here the ban occurred in this area. That's very important. That just now you have seen that assertion is a question here. Then actually in amniocentesis what happens here? Very simple. In amniocentesis, a needle is introduced into the amniotic cavity by a surgeon. They take a drop of amniotic fluid, in which fetals, the skin cells are present. First they examine the chromosomes, and based on the barred body is not there, it is male, it is there, it is female. Then after that, the chromosomal pattern and amniotic fluid, they check that area so that enzymatic disorders, chromosomal disorders, syndromes, we can identify. That's the actual purpose here. But the first step, when the sex of the baby is decided on the basis of XX chromosomes, XY, or presence of barred body or absence of barred body, the people are stopping there only. And they started a brutal act. That is the termination of that pregnancy if that fetus is a female. So this is the discussion in this area. Now after that, you see, this is Saheli. Saheli, very, very important. A new oral contraceptive, the pill, non-steroidal, very, very important non-steroidal. This was designed by CDRI Lucknow. See this. Next page. Central Drug Research Institute of Lucknow, where the scientists have developed Saheli. It is 1 week pill and once in a week, very important. Non-steroidal, very, very important. Very, very important. And CDRI Lucknow is important, and that's a condition. It is having centroman, and that's a condition here. Then after that, population stabilization and birth control you have to see here. Very simple. Here, 3 years are given. One is 1900, then 2000, and 2011. Then 2 billion, the world population 1900, and rocked about 6 billion by 2000. When it comes to 2011, 7.2. 2 billion became 6, and 6 became 2011, 7.2. That data you have to memorize here. It's a memory-based area. 1900, how much? 2000, how much? 2011, how much? And you have to memorize. At the same time, Indian population is also given here. You see that. In India, it was approximately 350 millions at the time of independence. That was 1947. India became independent. During that time, the population was 350 million. And at the time, that is the point. Then, when it comes to the 2000, crossed 1.4 billion. And when it comes to this, today it is 140 crores. So this data is important. And here, when is the data is given, world population one side, Indian population one side, 1900, 2000, 2011 with respect to the world. In the case of India, 1947, 2000, 2011, memorize all this. But why the population explosion is going on? Here I have shown the underlying lines. This is increased health facilities along with the better living conditions had an explosive impact on the growth of the population. The people are living in better living conditions. Health facilities are increased. These are the two reasons. Later they gave the statistics. Again, the related matter placed somewhere else here. Put these two together, and here the rapid decline in death rate and maternal mortality rate is also declined. Infant mortality rate is declined. So rapid decline in death rate, rapid decline in MMR rate, maternal mortality rate, infant mortality rate, and increase in number of population, the reproducible age. So these two you join together. That means put this matter away, put them together. Increase health facilities, people are living in better conditions here, rapid decline in the maternal mortality, infant mortality, and reproducible age people number increased. These are the reasons for population explosion. And put these underlying words together, then we'll get it. Then this is another important point, several times it was asked here. According to 2011 census, and it is less than 2%. That is population growth is less than 2%. Direct question this is. What was the world population in 1900? What was the world population in 2000? What was the world population in 2011? 3 questions, fair. What was the population of India in 1947? And the population of India, that is 2000. Population of India 2011. These are 6 questions here. This is another question. And here the growth rate was less than 2%, right? Less than 2% means another expression is also there. You see that. 2% means 2 in 100, 20 per 1000 per year. Both are same. 2% or 20 per 1000 per year. Both are same. That's the condition here. So after that, to reduce that here, hum do, hamare do. The government of India, family planning programs, we too, ours too. We, wife and husband too, we have 2 children. That is one slogan. In Hindi, it is hum do, hamare do. Then after that, one child norm is also started. One child. Why? Because still the population is not decreasing. Not decreasing. That's why later government of India came out with one more program, one child norm. The idea is the control on population explosion. Why? Because health facilities are increasing and the hospital facilities are increasing. And the other rates, maternal mortality rate, infant mortality rate, and those are decreasing. Reproducible age people are increasing. So that's why let us go for minimizing the size of the family. That's the idea. Okay. So these are the conditions here in which, in order to control this population, here we have some contraceptive methods. Contraception means the intentional prevention of conception. The intentional prevention of conception. Conception means fertilization. Intentionally, we are avoiding fertilization. Intentionally, we are avoiding pregnancy. That is contraception. The contraceptive methods you can see here. There is natural or traditional methods, barrier methods, IUDs, oral contraceptives, injectables, implants, and surgical methods. When all are present in a clumsy manner and it gives some trouble to recall, to recollect, that's why here we have a flow chart. Various contraceptive methods, total 6 methods are there. Natural or traditional methods, second barrier methods, 3 IUD, intrauterine devices, 4 oral contraceptives, 5 injectables and implants, 6 surgical methods. When a flow chart is there, a tabular form, it is easy to remember. Here, natural or traditional methods, periodic abstinence, withdrawal, its other name, coitus interruptus, lactation pneumonia, 3 sub-methods. Barriers are disposable, reusable. Some are disposable, some are reusable. IUDs are non-medicated, copper releasing, hormone releasing. Then oral contraceptives, daily, every day 1 pill, 21 days, 21 pills. Then once a week pill. Just now we said Saheli. Saheli, 1 month, 4 pills. Injectables and implants. Some injections are there to achieve contraception. Implants, emergency contraceptives. Then surgical methods, vasectomy and tubectomy. Vasectomy and tubectomy. So these are the methods here. Once again, natural or traditional methods 3. Periodic abstinence, withdrawal, lactation amenorrhea. Barrier methods 2. Some are disposable, some are reusable. Intrauterine devices, those are non-medicated, copper releasing and hormone releasing. Then oral contraceptives, daily 1 pill, 21 pills, 21 days. Then once a week pill, Saheli. Then injectables, some injections are there, implants are there, emergency contraceptives are also present to avoid the unwanted pregnancies. Then surgical methods, vasectomy and tubectomy, just you have put all them together like a flow chart, our things become easier. Now, one after another, I will show the important areas here. So this NCERT book again, and you see here. Natural methods 3 are there. Periodic abstinence, withdrawal or coitus interruptus, lactation amenorrhea. Periodic abstinence means here avoiding coitus from 10th day to 17th day of menstrual cycle. 10th day to 17th day, avoid coitus. Coitus is the other name, decent word for copulation. Copulation, intercourse, and these are normal words. Coitus is a decent word, and we will ask that couple avoid coitus and between these 10 to 17 days. Why? Because during that time ovulation occurs, and that's the condition. And that is it. Second one, withdrawal. Withdrawal, and that is coitus interruptus is another method. So here male partner can start the coitus, in the climax of the coitus, taking the penis out of the vagina, withdrawing the penis out of the vagina so that insemination occurs outside the female body. That is withdrawal. That is just before ejaculation, withdrawing the penis from the vagina. Then after that, here third one, barrier methods. So here three methods are there. First, periodic abstinence. Here avoiding coitus between 10 to 17 days. Then second method, that is withdrawal, withdrawing penis. Third method, lactational amenorrhea. And as long as the baby is suckling the milk, because of prolactin elevation, ovulation may not occur. So during that period, and here ovulation may not occur. These three come under natural method. And after that, let us come to the second method, barrier methods. Barriers means, see this line, very important. In barrier methods, ovum and sperms are prevented from physical meeting. So everything is normal, but the ovum and sperm, they never meet physically. Between these two, there is a barrier, there is a barricade, there is barriers. In these barriers, you can see two types are there. Some are disposable, female condom, this is male condom. This is a male condom, this female. Here, these are made up of either rubber or latex. Rubber or latex, they are available quite easily, and Government of India is also supplying it free of cost here. So, how to use them? Very simple here. And when a man is approaching for coitus, when the penis is erected, above the erected penis, he should have the condom. And it will hold the penis completely and holds tightly with the help of this ring-like structure here. Now the penis, erected penis, covered with this rubber sheath, the so-called condom, will be introduced into the vagina. Then he can start and complete the coitus. In the climax of the coitus, here the ejaculation occurs here, semen is delivered. That is delivered here in the nipple-like structure. So both partners will separate. After that, from the penis, the condom is separated and thrown it outside. Why? Because it is one-time usable. The similar fashion, this is female condom. This is also made up of latex or rubber. And just before, when the husband is ready to introduce the penis into her vagina, the woman has to take the condom. She has to place the condom in her vagina. When the condom is introduced in her vagina and the husband introduces the penis, of course, into the vagina, but it is internally covered by the condom. That means the penis is a naked penis, uncovered, but enters into the vagina, which is covered by condom. So the penis enters into the condom. Insemination occurs in the condom. So after the coitus is over, the woman has to take it out and they can throw it. These are one-time usable, one time. But whereas second one, reusable are also there. Diaphragms, cervical caps and warts. In NCERT, they have highlighted that areas. Diaphragm, cervical caps and warts here. Diaphragm holds the cervix here. Cervical cap holds the cervix and warts. These are made up of rubber generally. Just before coitus, when the penis is about to introduce, the woman has to take these structures here, should be introduced into the vagina. Through the vagina, when they entered, they hold the cervix. So automatically what happens here, the penis will enter and copulation is completed and semen is delivered. After the copulation is over, the semen remains in the vagina. When the woman stands here, the seminal fluid comes out. After that, she removes that the vault or cervical cap or diaphragm, they can wash it, they can use it again. So these are reusable. But another important area is also present here, that is it here. These are reusable, very important, that is one-time usable. Reusable, spermicidal creams, jellies and foams are usually used along with these barriers to increase their contraceptive efficiency. Very important. Either we are using one-time usable barrier or reusable. Along with that, the spermicidal creams, the creams in which chemicals are present like potassium permanganate and citric acid, boric acid, etc. Those are also used. This is very important area. Very important. So to prevent the conception by blocking the entry of these sperms through the cervix, these are used. And along with them, we are using these also. So definitely it gives excellent result. Excellent result. Because sometimes some of these sperms may escape. They may reach the uterus. From there they reach ampulla here. Then IUDs. IUDs means intrauterine devices. See this? This is copper T. Intrauterine devices. Intra means within. Inside the uterus, you have to place these devices. These are of three types. Non-medicated, copper releasing, hormone releasing. Non-medicated IUD, that is Lippi's loop. That is Lippi's loop. Very, very important this is. See, non-medicated. Simply it's a loop-like structure made up of plastic. But the woman cannot insert. Like barriers. Barriers, husband or wife or both, they can use, they can handle. It will protect the privacy. But whereas this method, and she has to go to the hospital, either a doctor or a trainee nurse, by taking very short time, they place this intrauterine device in the uterus. So first of all, IUDs are of three types already I mentioned. Non-medicated IUDs, Lippi's loop, it increases the phagocytosis of sperms. All sperms are phagocytosed because of this. That's the only advantage. Coming to the second method, copper releasing. Copper releasing CUT, CU7, multi-load 375. And these have two functions. And phagocytosis of sperms, that is one function. Additional function, the copper ions released, they suppress the sperm motility and fertility. So Lippi's loop only one advantage, phagocytosis of sperms. Copper releasing two, phagocytosis. In addition to that, the copper ions, they suppress the sperm motility and fertilizing capacity of sperms. Then hormone releasing are also present. Hormone releasing C. Here, these are used uterus unsuitable implantation, cervix hostile. These are giving three functions. Phagocytosis, then second one, and makes the uterus unsuitable for implantation, and third one, and changes the cervix hostile to the sperms. Now the conclusion, all IUDs, very important, all IUDs, phagocytosis of sperms is common. Then copper releasing, in addition to phagocytosis, they decrease the sperm fertility and motility. But hormone releasing, progesterone and LNG20 are there, and you see that, progesterone and LNG20. Here, you can see, progesterone and LNG20, these have three uses. One is nothing but phagocytosis. Second one is nothing but making uterus unsuitable and cervix hostile with sperms. These are the methods. Then after that, oral administration, you see here. So small doses of either progestogens or progestogen-estrogen combinations you have to use. Progestogen-estrogen combinations you have to use here. These are the pills here, and these are taken every day 21 days. Every day the woman has to take a pill. The pill consists of either progestogen or progestogen-estrogen combinations here. Starting from this, very important, starting from within the first 5 days of the menstrual cycle, like this is. within the first 5 days of menstrual cycle with a gap of 7 days. For example, first 3 days pill is not taken. First day of menstrual cycle, no pill. Second day, no pill. Third day, no pill. First pill is taken on 4th day. Second pill on 5th day. Like that 21 days. 21 days, 21 pills. This 21, first 3 days, pills are not taken. That 3 plus 21, 24. And 28 days is the general duration of menstrual cycle. 28 minus 24, 4 days. So 4 days later, she will have normal menses. Again 3 days gap. That 3 plus 4, that is 7 days. That is 7 days gap. It's a gap of 7 days. Very, very important in this area. That's it. First 3 days pills are not taken. And after the taking a final 21st pill, 4 days later she will get menses. That 3 plus 4, 7. Or this 4, after next menses, first 3. Then you can go for this. Okay, that's it. Already we mentioned the Haley oral contraceptive female, non-steroidal, most important. Most important. Saheli, once a week pill, non-steroidal, CDRI Lakno. These are the important areas. Be careful. Then after that, you see, progestrogens alone, only progestrogens, or a combination with estrogen can also be used as by females as injections or implants. Injections or implant, this implant. See this implant here. Here what they are using here, either progestogen alone or combination of estrogen with progestogen, then it is taken here. They can give long time effect here. Then this is very, very important to avoid unwanted pregnancies. In emergency case, emergency contraceptives. Administration of progestogens alone or progestogen estrogen combinations or IUDs, it is surprising. Within 72 hours of coitus have been found to be very effective as emergency contraceptives. Either progestogen alone or combination of progestogen and estrogen or IUDs. Use them just within 72 hours of coitus, so that unwanted pregnancies can be avoided. One wife and husband participate in coitus, unprotected sex. Now they have a doubt they may have the pregnancy. In that condition, we will go for this. That is 72 hours. We have to take, very, very important. After that, the termination method, very important this is. Terminal method, end method this is. In which we have two. These are operations, simple minor operations here. Vasectomy, tubectomy. Vasectomy means this is the male reproductive system. Here the surgeon, the not surgeon, even the MBBS doctors also can do that. They will hold the scrotum of the man, they will take the razor blade, a surgical blade, and they make small incision. Small incision. Before that they will give local anesthesia. Local anesthesia, only that part is anesthetized. So that's why when you have made the incision, they will take the vas deferens outside, this cut and remove some portion and tie it back. That is vasectomy. It takes 10-15 minutes operation only, and after that they can have the sutures here. So in this condition, here the semen never comes. The sperms remain here only. Even though they are coming here, they cannot come out. That's the idea of vasectomy. It is a terminal method. Terminal method, very important, and for males. And it is having no side effects. Simple operation, and the vasectomized male never have children. Why? Because even though semen comes out, in which spermatozoa are not present. Now coming to the tubectomy, this female reproductive system. This is uterus. These two are ovaries. These are fallopian tubes. And this is vagina. Here, two methods are there. By making an incision in abdomen, if it is a female body, they will make an incision through which they reach the fallopian tubes. That is one method. Second method, through vagina. Be careful. Either through abdomen, in abdominal incision, or through vagina, they reach the fallopian tubes, they cut and remove small piece of fallopian tube, these are tied back. This is tubectomy. That's why here these are the ovaries. They release ova, and the released ova cannot reach here, and they stop here only. This female condom, this is male condom, nirod, this female. Here these are made up of either rubber or latex. Rubber or latex, they are available quite easily, and Government of India is also supplying it free of cost here. So how to use them? Very simple here. And when a man is approaching for coitus, when the penis is erected, above the erected penis, he should have the condom. And it will hold the penis completely and holds tightly with the help of this ring-like structure here. Now the penis, erected penis, covered with this rubber sheath, the so-called condom, will be introduced into the vagina. Then he can start and complete the coitus. In the climax of the coitus, here the ejaculation occurs here, semen is delivered, that is delivered here in the nipple-like structure. So both partners will separate. After that, from the penis, the condom is separated and thrown it outside. Why? Because it is one-time usable. The similar fashion, this is female condom. This is also made up of latex or rubber. And just before, when the husband is ready to introduce the penis into her vagina, the woman has to take the condom. She has to place the condom in her vagina. When the condom is introduced in her vagina and the husband introduces the penis, of course, into the vagina, but it is internally covered by the condom. That means the penis is a naked penis, uncovered, but enters into the vagina, which is covered by condom. So the penis enters into the condom. Insemination occurs in the condom. So after the coitus is over, the woman has to take it out and they can throw it. These are one-time usable, one time. But whereas second one, reusable are also there. Diaphragms, cervical caps and warts. In NCERT, they have highlighted that areas. Diaphragm, cervical caps and warts here. Diaphragm holds the cervix here. Cervical cap holds the cervix and warts. These are made up of rubber generally. Just before coitus, when the penis is about to introduce, the woman has to take these structures here, should be introduced into the vagina. Through the vagina, when they entered, they hold the cervix. So automatically what happens here, the penis will enter and copulation is completed and semen is delivered. After the copulation is over, the semen remains in the vagina. When the woman stands here, the seminal fluid comes out. After that, she removes that the vault or cervical cap or diaphragm. They can wash it, they can use it again. So these are reusable. But another important area is also present here, that is it here. These are reusable, very important, that is one-time usable. Reusable, spermicidal creams, jellies and foams are usually used along with these barriers to increase their contraceptive efficiency. Very important. Either we are using one-time usable barrier or reusable, along with that the spermicidal creams. The creams in which chemicals are present, like potassium permanganate and citric acid, boric acid, etc. Those are also used. This is very important area. Very important. So to prevent the conception, by blocking the entry of these forms through the cervix, these are used. And along with them, we are using these also. So definitely it gives excellent result. Excellent result. Because sometimes you are required here, it is a punishable crime. If any doctor is going against this condition here, because the continuation of pregnancy would risk in the life of pregnant woman or grave injury or physical or mental health. Or the baby is a perfectly wrong baby, all certificates should be produced here. Within 12 weeks, one registered medical practitioner, then more than that, that is 2. That's it. Now, these are the conditions here. So, the MTPs are considered safe during 12 weeks. That's already we explained here. Then riskier in second. Now, STDs. STDs means sexually transmitted diseases. These are also called reproductive tract infections. Then you can see the list here: gonorrhea, syphilis, genital herpes, chlamydiasis, genital rash, trichomoniasis, and hepatitis B, and AIDS, etc. here, and these are the conditions here. Then in which bacterial diseases are there, viral are there, protozoan diseases are present, they may not be asked here. But here, see, except for hepatitis B, genital herpes and HIV infections, these three are non-curable, be careful. Other diseases are completely curable if detected early and treated. This is very popular area. Several times the people are setting questions here. Hepatitis B, genital herpes and HIV infections, which are identified any stage, death is inevitable. Remaining all like gonorrhea, syphilis, remaining areas, chlamydiasis, and those are curable. Then another important point here, this is most important. This is most important. Actually, most of these STDs are, females may be often asymptomatic. Suppose male got STD, female got STD, males the symptoms will express so that we can go for treatment. In the case of female these are asymptomatic, no symptoms at all. That's why in the 11th hour only which are identified, that is the troublesome in this area. Then, and in the case of female, if she is suffering from these STDs, if she became pregnant and stillbirth occurs here, ectopic pregnancies, pregnancy outside the uterus, stillbirth, the baby will die, pelvic inflammatory diseases and infertility, even cancer to the reproductive tract. And these are very important. In most of the females, these are asymptomatic, very, very important, and these are the areas here. That's it. Then infertility. Infertility means here the inability to contribute to concept is infertility. Here one important point is also there, that is it is the problems in physical problem, psychological problems, some problems may be there, but more often, and the problems are related to male partner. See this, very important. But we are living in a society, it's a male-dominated society, that's why the females are blamed. But generally, when you look into the cases what are recorded so far, most of the males are having this. Out of 10 cases we recorded, more than 6 are males. That's the point. Here we are conducting assisted reproductive technologies here, in vitro fertilization and embryo transfer. In vitro means fertilization in laboratory. You will take the ovum and spermatozoa either from husband or donor, wife or donor, and we will create a facility in a petri dish in laboratory. You will conduct fertilization in laboratory. That is in vitro fertilization. And after that, the embryo is transferred. It is popularly called as test tube baby program, in which two important methods are there. The zygote or early embryos with 8 blastomeres transferred into fallopian tube. We conducted fertilization in laboratory, IVF. We got zygote, transferred zygote into fallopian tube, or embryo up to 8 blastomeres to the fallopian tube. That is intrafallopian transfer. Zygote intrafallopian transfer. Don't think that only zygote only. Zygote or embryo up to 8 blastomeres. Then after that, suppose if the embryo crosses that number, then directly intrauterine transfer. This is intrauterine transfer. So, the zygote or embryo up to 8 blastomeres, fallopian tube, and more than that, that is intrauterine transfer, that's it. Then embryo is formed by in vivo. In vivo, you have to understand this point here. In vivo means natural fertilization. Fertilization occurs in fallopian tube and ampulla. If it is happened, we use the word in vivo. Okay, that's it. Then transfer of ovum collected from a donor to the fallopian tube, gamete intrafallopian transfer. Only for females. Gamete intrafallopian transfer. One woman is there, and the woman cannot produce ova. But she can provide suitable environment for fertilization. One woman unable to produce ova because of some reasons, But the rest of the system is quite perfectly good. She can provide the environment for fertilization. Then we will collect the ova, second oocyte, from the donor, transferred into the fallopian tube. That is a gamete intrafallopian transfer in which fertilization occurs. That is in vivo. That is in vivo. Be careful. Then after that, artificial insemination you see here. The persons with low sperm count, and we will go for this. The persons with low sperm count, we can go for artificial insemination. Here in artificial insemination, two methods are there. And artificial insemination, if the semen is collected from the husband or donor and released into the vagina, artificial insemination. Released into the uterus, that is also artificial insemination. So vagina or into the uterus, be careful. But specifically, sometimes they can ask this. This is intrauterine insemination. Intrauterine insemination means release of semen into uterus only. Artificial insemination means either in vagina or into uterus. Okay, that's the condition. Now, after going for this, finally, we can go for that adoption. These techniques are slightly expensive here, but our laws are permitting for legal adaptability. Here, this point, by saying one question, I will conclude here. That once, I think it is 2019, a question was asked. That question is, which of the following ART method is suitable for the persons with low sperm count? They gave two options. One is artificial insemination. Other one is intracytoplasmic sperm injection. Two. Both are correct. But in that year, only artificial insemination option is given. Option is given. Why? Because it is given in our NCERT book. So even though intracytoplasmic sperm injection is also correct, and it is not mentioned in NCERT, that's it. And a couple of days ago, and the NTA released some model papers for 2026, where they gave a couple are not having children because of a low sperm count in the husband. Which of the following methods are suitable? In which they gave in one option, two techniques are given. In that they gave, one is artificial insemination and intracytoplasmic sperm injection. That is quite perfect. But any dilemma is there, what is there in NCERT, it is final. It is final. So don't take any chances. Fact is secondary and NCERT is primary. According to the book, and two options are given. One is artificial insemination, other one is intracytoplasmic sperm injection. And you have to choose only one, go for NCERT. Then adoption is the best. After that summary additional points are not there. Have a look on that area. And that's the NCERT content. Then you see the exercise also, that's it. After that we will start the other videos, small videos I will show. Now I am showing you the two diagrams. One is vasectomy, other one is tubectomy. These two are contraceptive methods, you know it well, surgical methods. Vasectomy is related to male, tubectomy is female. How it is conducted? Very simple. Here a local anesthesia is given to the male. Local anesthesia, the doctor will take the scrotum in the hands, they give the analgesic injection here, and after that they will take the surgical blade, cut, make a small incision. Then the two vasa differential are taken outside and these are cut and tied back. That is a simple operation. So local anesthesia is given, a small incision on the scrotum, two vasa differential are taken outside, these are cut and tied back. This is vasectomy. And 2 or 3 days later the person become absolutely normal. From that moment onwards, that person will have normal sexual life without any ill effects, without any side effects here, and simply he can participate with the same vigorosity in that coitus. But when the semen is coming out here, and here it is only seminal plasma, no sperms. Why? Because here the sperms are produced here, they cannot come out. But in the climax of coitus, when the ejaculation occurs here and the fluid from seminal vesicles, prostate gland and corpus gland, that only will come out. Here you have to know one important line of human reproduction: seminal plasma plus sperms is equal to semen. That means a vasectomized male cannot release semen. He can release seminal plasma only, in which no spermatozoa, 100% guarantee this person after vasectomy he never become father. And except that, everything, the sexual life is normal. Coming to the tubectomy, it is slightly a bit complicated. Why? Because general anesthesia is given, and here two methods are there. The surgeon will make an incision abdomen here or here, then they will take the fallopian tubes out and they cut and they tie back, same method. But incision in the abdomen, that is one method. Through the vagina, second method. Finally, here the vasa, the fallopian tubes are disconnected. So after the tubectomy, when this woman allows her husband to copulate her, penis will come up to here, you know. Here the insemination occurs. Sperms will come, crosses the cervix, uterus and fallopian tube, that's all. Then whereas these are the ovaries, they release the ova. Of course, in fact, secondary oocytes, these are collected by fimbriae, they come here. So sperms will stop here and the secondary oocyte stops here. No meeting of the gametes, either in this method or in this method. Just here, vasa differentia are disconnected. Here, fallopian tubes are cut and tied back. That's the condition. So, like this man, the woman has, she will have all normal activities. That means the ovulation occurs here, menstruation occurs here, everything is normal. Everything. This is called as a surgical method. It is almost all permanent. Now I am showing you the two contraceptive agents. This is the Nirod, that is male condom, and this is reality, the female condom. Here the condoms are made up of either rubber or latex. After the erection is over, above the erected penis, just before starting the coitus, the man will have this condom above this. Then later the remaining coitus process is normal. In the climax of coitus, insemination occurs in this area. After the coitus is completed, both wife and husband will separate and the condom is taken out and thrown out. It is one time usable. The same thing, this female condom. It is made up of a latex or rubber here, but this time, instead of husband, the wife should take the responsibility and she has to take it outside and place it in her vagina. So in the condom, so the husband with a normal penis, uncovered penis, now it introduced here, now insemination occurs inside. So after the coitus is completed, simply it is removed. It is removed here. These two are one time usable. This is the husband will use, this is the wife will use. But insemination occurs in this male condom inside, in female condom. That's it. So the condoms are giving advantage. And they protect these members from STDs, sexually transmitted diseases. That is one additional advantage. The major advantages are, these are available easily. These are less expensive. These are user friendly. Those are using, and they are user friendly, available easily and less expensive. They never interfere the sexual drive of the individual here. Same sexual enjoyment, same pleasure, but they never have the children. These are the advantages of these two here, and it is most widely accepted methods in India. Why? Because available easily and less expensive. In addition to that, in primary health centers, Government of India is supplying them at no cost. That is also one of the factors here, and that is about the barrier methods. Yes, now I am showing you a short reel. The natural methods of contraception, Side effects are almost nil, but chances of failure are very high. Side effects are almost nil. Why? Because in these methods, we are not using any chemicals or any agents. There is no chance to have side effects. And failure chances are very high when you take the first method, avoiding coitus between 10th to 17th day. Where the ovulation occurs? Ovulation never occurs exactly in that period. Sometimes before, sometimes later. Failure chance. Withdrawing penis from the vagina in the climax of coitus is almost all impossible in many cases. That is the second reason. And the third one, lactation amenorrhea, prolactin levels will fluctuate so that there is a chance of ovulation. Because of these three reasons, failure chances are high, no side effects. That's one rule. Then the second one, female feticides and amniocentesis. Amniocentesis is a diagnostic technique in which you will take a needle, it is introduced into the amniotic fluid without causing harm to the fetus and mother, and you will take just 1 or 2 drops of amniotic fluid in which fetal skin cells are there, in which you will examine the chromosomal pattern first. First sex determination, then chromosomal nature, then the fluid in which enzymes are there will test it. And that is amniocentesis. But unfortunately, many people are misusing that. After knowing that the baby is going to be female and they are killing the baby. It's a brutal act. So because of that reason, Government of India banned amniocentesis. Then another short reel, in vitro and in vivo fertilizations. In vitro fertilization means fertilization in laboratory. We will create facilities, same conditions what are present in fallopian tube in the laboratory, and there if you are conducting fertilization in vitro. So test tube baby technique comes under this. In vivo fertilization means fertilization occurs normally in fallopian tube. In RT methods, gamete intrafallopian transfer, artificial insemination, they come under in vivo fertilization. Fertilization normally occurs in normal site of fallopian tube. That's it. So here artificial insemination comes in this area, then gamete intrafallopian transfer remaining comes in. Now I am showing you some of the related questions which are important. These are related models. See, the assertion is in question. Females infected with venereal diseases may remain undetected for long. Correct. And here in reproductive tract infections, the infected females may often be asymptomatic. No symptoms at all. So that's why they are not detected. Both assertion reason are true, or is the correct explanation of A. Next question, statement A and statement B. Periodic abstinence is a natural method in which couples avoid coitus from 10th to 17th day. It is a fertilization time. That's the point. The female, this is correct statement. In female humans, ovulation could be expected from 10th to 17th day of the menstrual cycle could be expected. So both are correct here. Both are correct. Then another one, MTPs are considered relatively safe during first trimester. First 3 months, MTP is perfect. Perfect, no risk at all. Now coming to the pick out the odd one with reference to the contraceptives. Here condom is odd one. Why? Because diaphragms, valves and cervical caps, these are barriers. Diaphragm, valves and cervical caps, the caps, but condoms are one time usable, these are reusable. Then see the matching here, Saheli and copper releasing IUD, cervical caps and oral contraceptives, just you match them directly here. Then what is the following is the probable reason for the growth of Indian population. This is very, very, very important. Increase in number of reproducible age people. Generally, the student cannot see it. Increase in health facilities. Like that you can go, but like this. But according to 2011 census report, here less than 2%. That is population growth rate. Then coming to the world population was around 2 billion in 1900, rocked to about 6 billion by 2000 and increased about dash, fill in the blanks are also there, that is 7.2 billions, that's it. Then which of the following is widely accepted method of contraceptive in India? Usage of intrauterine devices. Then after that, which of the following are the important features of ideal contraceptive? It should be user friendly, it should be available easily, correct? And first one is correct, second is correct. It should be more effective, correct? It should be reversible with no or least side effects, and it should in no way interfere. So all are correct, A to E are correct here. All require in vitro fertilization except gamete intrafallopian transfer, it is in vivo fertilization. Then according to the Medical Termination of Pregnancy Amendment Act, a pregnancy within first 12 weeks, it can be terminated on the opinion of just one registered medical practitioner only. Then coming to the intrauterine insemination, here only uterus you have to release, only uterus. Then coming to the, which of the following STIs are not curable? Hepatitis B, genital herpes and HIV infection. These three are non-curable even though detected early. Then final question, main effect of multi-node 375 suppresses the sperm motility. Sperm motility. Suppose in this question, phagocytosis is also given, that is also correct here, but that is not given, suppresses sperm motility and fertility also. So these are the some of the important model questions. Go through them and read the topic quite thoroughly, confine to the NCERT and cover every line, every nook and corner, what I have shown, follow it quite perfectly. So that if it is one question or two questions or three questions, you will reach the answer 100%. All the best. God bless you.